Good morning, everyone, on a beautiful Long Beach morning. I know it's Monday, so let's get up and get going. Last night's show was all about breast cancer awareness, and we had so much information to cover that I didn't get to cover my whole entire spot. So, as promised, I'm going to post some of the information, but I figured doing a YouTube video would be a lot more personable and would be able to allow me to interact and share the information that I had last night. So first, let me start off by saying that the person that I work with, who is a specialist in doing cancer and exercise protocols, her name is Lisa Hoffman, and she has a great book, The Healing Power of Movement and How to Benefit from Physical Activity During Your Cancer Treatment. It's available on Amazon and Barnes & Noble. Online, I'm sure you can search and Google it and Bing it and everything else that you possibly can imagine. And our program together, which I'm helping to promote, is called Make a Pact for Life. And that is a training protocol program for trainers and practitioners who want to bring exercise protocols into their practice, whether you're a physical therapist, a phys ed teacher, a certified personal trainer. This is a specialty niche training program, and Lisa is second to none in her abilities and her knowledge, and I'm very, very excited to be working with her, especially with Breast Cancer Awareness Month. If you heard a little bit about my story last night, my grandmother survived over 30 years, and God bless her. And my mom is a 3-year now cancer survivor. Hi, Mom. As I said last night on air, I love you, and I'm so happy that we are still able to share this time and that you are healthy and cancer-free. It means the world to me. So with that being said, here's some of the information from last night. I'm sorry if I'm not always eyeballing the camera here, but I really want to share all of this with you, and Lisa provided this information for me. There are dozens of studies that show physically active women have a lower risk of developing breast cancer than inactive women. And according to the National Cancer Institute, existing evidence shows decreasing risk of breast cancer as the frequency and duration of physical activity increase. When we talk about frequency, we're talking about how often you're exercising, and the duration is how long you're exercising during those frequent periods. There are specific protocols, and making sure that you rest, particularly if you are a cancer survivor or you are going through treatment. And in general, your rest protocols are very, very important to the healing process. When we rest, when we sleep, when we take days off from training, that is when we actually are healing. So moving forward, most studies suggest that 30 to 60 minutes per day of moderate to high intensity exercise and physical activity associated with reduction in the breast cancer. Hey, most studies state that those protocols actually meet what we call our ACSM guidelines of the American College of Sports Medicine, which, as a personal trainer, group exercise instructor, fitness professional, those are protocols that we are required to know and to follow in terms of utilizing safety. So these things are very much in line with even the specialty training protocols. Studies also show that activity after breast cancer diagnosis may reduce the risk of death from the disease. A recent report by Macmillan Cancer Support found that breast cancer's patient risk of recurrence and of dying from breast cancer can be reduced by up to 40% by doing 150 minutes of moderate intensity physical activity a week. It's not 150 minutes in one sitting, although it can be if you're able to, function at that level. It is, like I said, in the frequency, it is the volume over time. So if you do that 3 to 5 days a week, you can do the math. The report also found that after treatment, all cancer patients can reduce their risk of getting side effects of cancer and its treatments, such as fatigue, depression, osteoporosis, heart disease, by doing the same 150 minutes of physical activity. Last night on the show, I spoke at length about the emotional capacity and depression and what goes on. And the one thing I didn't really get to touch on, and I wanted to, was that a support system, your family, your friends, even Facebook and your social media, can have a huge and uplifting benefit from allowing you to keep yourself in a positive frame of mind and looking forward and not falling back and feeling sorry for yourself. But the people around you, that support system, is such a key. And last night, I remember Scott Morton, our music director, spoke about, how his mom, their driving force, and someone else said that Toby Tobias, I remember saying last night also, was that his wife was the one holding everybody else together. So it's very important that you gel, and my mom remarked about how important it was that my father and my sisters and their grandchildren, my nieces and nephews, and our close family and friends really made a difference in how my mom took a hold of this disease and the treatment and moved forward with it, and stayed very happy and very positive. The most common issues that plague post-mastectomy patients are upper cross syndrome and range of motion limitations in the affected shoulder. Upper cross syndrome is the combination of a protracted or rounded shoulders, forward head, cervical, what we call lordosis, winged scapula, and thoracic kyphosis. Basically, it's a bent head, very tight postural position. It's a protective position, and many people today, we sit and type and do many other things, so we already are having issues with those postural deviations. So we have to address those and make sure that we are still strengthening and improving the range of motion and becoming very aware of our posture. So moving on, as a result, these postural deviations, mastectomy, lymph node dissection, and/or radiation, the chest muscles, as I just mentioned, may become tight, shortened, and spastic. They may spasm and may limit the ability of the patient to move their arm or shoulder through flexion, extension, abduction, and external rotation. And these are all very important ranges of motion that we need in movement, just to function in our activities of daily life. Not only will it further exacerbate the upper cross syndrome, it will create a muscle imbalance in the area of the surgery, if either the rectus abdominis, your abs, or the latissimus, those are the wings, are used for reconstruction. So in some cases they actually, dissect the muscle and utilize that tissue to repair. So we have a lot of different issues that could be going on that we need to focus on, and working with this particular population, we need to be aware of it, and how to improve those ranges of motion and strengthen as well. For example, a client presents with a moderate to severe upper cross syndrome. Performing any kind of pushing exercise that would involve the chest muscles, say a chest press or push-up, even a wall push-up, could make the syndrome even more pronounced, causing the pectoral muscles to tighten and contract. Instead, the goal needs to be on creating range of motion, flexibility in the chest, and strengthening the opposing muscles in the back, particularly the scapular stabilizers. We want to talk about front to back, but 3 dimensions in training. We really want to make sure that we create that proper balance, that proper posture, that proper head position. Initially, the focus should be on the range of motion exercises, and this may include very basic exercises that the patient can do on their own. They have front wall walks, side wall walks, pendulum swings, a corner stretch, or even active isolated stretching, which happens to be one of my specialties, that can be executed with the assistance of a professional. And that's very key, that if you're going to do certain movements and certain training protocols, that you do have someone who is knowledgeable and professional and knows how to implement this in your program, because safety is paramount. The combination of both will increase the speed of improvement in most cases. Many women will either be of menopausal age or thrown into menopause from their cancer treatment. With estrogen no longer being produced, the risk of osteoporosis increases. To make things even more complicated, the long-term side effects of chemotherapy include osteoporosis, diabetes, damage to the heart and lungs, all of which can be avoided or improved through proper exercise recommendations. The last part of the equation is the lymphedema of the affected arm and shoulder. Lymphedema is the swelling of the extremity following removal of or radiation to the lymph nodes on that particular side. Even if someone has undergone a sentinel node biopsy and only had 1 node removed, they can still get lymphedema. Lymphedema is progressive if untreated and can be very painful and disfiguring. It could happen at any time after surgery, 1 hour or 50 years. So the risk doesn't increase or decrease. Now, therefore, we no longer know what the individual exercise threshold is. It is critical to start and progress slowly, which is any exercise program when you are beginning, particularly if you've been lazy or laid off or just haven't started one in the first place. So we want to start with micro progressions, move forward very slowly, build a base. This allows for gradual increase in frequency, intensity, and duration of the exercise program. If at any point there is swelling, the patient should be advised to stop exercising and their doctor immediately to determine if in fact they do have the onset of lymphedema. It is very important that as a fitness professional, phys ed, physical therapist, that you are aware of these protocols and all of the potential side effects of the exercise protocols, and that you interact with their physician very, very carefully and very, very often. And you really need to be on top of your game and aware of this. With that being said, I am very excited to have this spot on the show and be able to share this information that I wasn't able to provide last night. As you can see, there's quite a bit of information, and if you ever need to find out about becoming a professional that wants to work with this population, you can go to my website, which is fitnesseducationinstitute.com. Lisa Hoffman and I are finishing the manual, and we are going to be putting up our schedule very soon as to when this course will be offered. And if you're interested in training, you can definitely reach out to me. My training website is realitypersonaltraining.com, and I am so thankful that Mr. Halftime Howie has had me on the show as a regular now, and I want to thank everyone for watching and listening. And please reach out to us at any given time if you have any questions. And if I'm not able to provide the answer, I will find the expert who can. Have a great Monday, everybody, and I'll see you on the show next Sunday between 7 and 8 p.m., 1240 WGBB. You can also find us online. Bye-bye.